You're listening to Med School Radio. Here we are again looking at Sketchy Micro. Thank you very much for joining me for episode 300 of Med School Radio. I've really been enjoying making these podcasts and sharing my journey towards my MD. So please join with me as we continue on, this time with Sketchy Micro's Mycobacteria, Mycobacterium leprae, the good, the bad, and the lion-faced. Okay, let's go ahead and look at the image here. So we have Armadillo County Jail, and there's a guy inside the jail. He's looking out. There's a badge on the side that says Deputy Sheriff, a guy looking on with a rifle. There is an armadillo in front, and there is some dirt on the ground, and there's a shovel. There's a guy standing outside the jail who looks like he's sweating, holding a handkerchief. Looks like there was a jailbreak above, and somebody has escaped with some sheets outside the window. The escaping prisoner looks like he's trying to get onto a horse, and there's a bandit there who's wearing a mask, who has a pink gun. There's number 2. He's outside of his horse. I don't know why. There's number 1 on the other side, which is next to the guy in the jail. So let's go ahead and read it. Number 1, thrives in cool temperatures leading to growth in extremities. 2, acid-fast gunslinger, acid-fast carbonyl fusion stain. 3, tassels on the coat and jacket. Mycolic acids. Number 4, Armadillo County. Armadillos are the major reservoir, commonly called Hansen's disease. 5, Hansen the armadillo, Hansen's disease. 6, the clinical presentations. A, tuberculoid, that's number 1. Jail cell. 1, helper Th1 cell stimulate macrophages to engulf the bacteria in cell-mediated immunity. 2, well-demarcated bald spot. Mild symptoms, well-demarcated hairless lesions on the skin. 3, shovel in the mound of dirt. Lepraman's skin test. Test for immune reaction similar to the TB test. Will form if positive. And B, lepromatous presentation, which is number 2. So number 1, jail cell 2 with a laughing prisoner. Th2 cells promote humoral or humorous response. And the 2, prisoner breaking out of the cage, bacteria being unable to be contained in macrophages. 3, touching each other, high chance of transmission human to human. 4, prisoners are wearing glove and stockings. Distal portions are infected. Distal portions are affected in a glove and stocking pattern. 5, extensor surfaces with patches. Numerous extensor surfaces are cooler and present with disease of demarcated lesions. And 6, mask on the gunslinger. Leonine facies, facial deformity. 7, treatment, multi-drug therapy for a long time. 8, deputy carrying a rifle, Th1 dapsone and rifampin for 6 months, deputy and the rifle. And 9, deputy with rifle and white cloth and cloth escape rope, Th2 dapsone, rifampin, and clofazimine for 2 to 5 years. So there we have it, Mycobacterium leprae, the good, the bad, and the lion-faced. Just looking at Sketchy Micro's bacteria, Mycobacteria, Mycobacterium leprae, the good, the bad, and the lion-faced. Thanks again for joining me for my 300th episode of Med School Radio.